Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, April 9th, and this is my daily briefing. And I'm just going to let you know up front, you might hear some background noise on this video. They're doing some construction on the street behind me, so I just want to apologize in advance if that's disruptive. So we currently have 26 cases in Missoula. There are 354 cases in the state of Montana. There have been 6 deaths in the state, with 1 in our county, and we've had 14 recoveries to date in Missoula. Today, I just want to talk a little bit about enforcement. We've had several people reach out to us asking how the governor's orders and our local health department orders are being handled here in Missoula County. There's a sense that no one is enforcing things, and so we just want to make sure people understand that that's not true. The health department is charged with enforcing both the health officer's orders and the governor's directives to stay at home, only operate essential businesses, and quarantine for 14 days after travel out of the state. Inquiries and complaints are handled by our Environmental Health Division, and they've been very busy contacting businesses and individuals about complying with the orders and the directives. So when they get a complaint, they first reach out to the business or the individual, and they have a conversation about the order, why it's important. They talk about what needs to change. Often this is all that needs to happen, and both parties come away with just a better understanding of how to fulfill both the spirit and the intent of the orders and the specific requirements. Environmental health staff have found that most community members are willing to comply, and sometimes they just haven't thought about how the governor's directives actually apply to them. In addition to responding to complaints, questions, and concerns, our environmental health staff have also done a lot of spot checks to ensure that bars and restaurants and other businesses are operating in line with the health officer's orders and the governor's directives. In almost all cases, they found that the businesses are complying, or they just need to adjust how they're serving their customers just to further limit the potential for exposure. It's true that not all individuals and businesses are immediately receptive or compliant. When the first health officer's order to close restaurants and bars was issued, the health department elicited the help of the Missoula County Sheriff's Department, and deputies did visit with a few bars that were still operating despite the order. Later spot checks showed that those places were in compliant with the order, and environmental health staff also work closely with the Missoula County Attorney's Office, who have the authority to enforce the health officer's orders and the governor's directives. The county attorney's office has additional tools in place to convince businesses and individuals to comply. So the bottom line is that the orders are enforceable, but the reality is that we hope that instead of using a ton of resources forcing people to comply who are trying to get away with something that is risky, we want to rely on individuals and businesses to take the restrictions seriously and to do what's needed to slow the spread and keep themselves and their employees and their customers and the community safe. The more people who stay at home, work from home, and limit visits to even the essential places like grocery stores, the better chance we have of flattening the curve and not overwhelming our medical infrastructure and ultimately saving lives. So if you have questions about essential businesses or any of the orders, or if you have a complaint, you can email our group at envhealth@missoulacounty.us, or you can call them directly at 406-258-4755, and they can certainly help answer any questions that you might have, or they can respond to a complaint. So you may have seen our Facebook post last week on scams that are surrounding the COVID-19 incident. Scammers are definitely taking advantage of fear and manipulating people by email, by phone, and by text. There are some dangerous ones related to your health that I want to talk about today. If someone calls you trying to sell you a low-priced health insurance, it's most likely a scam. So please just hang up on robocalls